Ever since I was a kid, I was interested in medicine, and luckily for me, my parents were too. My dad, who studies esophageal diseases, was intrigued by one disease in certain, specifically gastroesophageal reflux disease, or GERD, which affects 7 million people in the US, including my uncles and relatives. I was curious because GERD affected the people in my life, yet I knew nothing about this disease. So after some interning, shadowing, and a lot of paperwork, I was able to gain a better understanding into GERD, from lab to treatment. Okay, so now that you know why I want to look further into this, let's look at some basic facts about GERD. GERD is a more serious chronic form of acid reflux and can cause a burning sensation in the chest, belching, as well as nausea. While GERD is not life-threatening, it can be very painful and difficult to manage. Since GERD remains non-life-threatening, it receives less attention in research, meaning less efforts are being made into healing a very common disease. But recently, researchers at Harvard University working in conjunction with UNC and NCCU have created a groundbreaking new medical product called hydrogel in order to treat GERD. One of these researchers is my dad, Dr. Vincent Chen, who is the head of the NCCU research branch in this project. He's here to talk about hydrogel and GERD in the lab.
Well, hydrogel is basically a new idea that we designed to put a sort of a adhesive helping the chemicals to stick to the surface of esophageal mucosa. Well, the reason we want to come up with this hydrogel is because when we drink water or eat stuff, those things will pass through the esophagus quickly. And you can imagine if you take a pill, those chemicals will pass through the esophagus very quickly. They won't be able to stay on the surface of the esophagus. So the hydrogel is going to help the chemicals to stay on the surface of the esophageal mucosa as well, a little bit longer, at least hours. So in a sense, this will promote extended release of the chemical into the esophageal mucosa and helping boost up the therapeutic efficacy.
Basically, hydrogel acts like a wet band-aid, covering the acid-scarred esophagus tissue, all the while releasing medication injected into the hydrogel directly onto the esophagus. This technology allows for fast-acting and efficient treatment of GERD.
Well, my lab has been working on how to improve efficacy of the chemicals or drugs for GERD. We created a mouse model, by surgery. We connect the stomach or the small intestine to the esophagus, so that we allow these intestinal contents or gastric contents reflux back into the esophagus, sort of mimicking what happened in humans. So then we collaborate with a group at Harvard. They created this hydrogel, and then we mix the chemical with the hydrogel and feed the mice, and hoping that this hydrogel will help these chemicals staying on the surface of the esophageal mucosa.
In short, Dr. Chen connects mice esophaguses to their stomachs, allowing for a direct flow of stomach acid into the esophagus, causing GERD in the mice. Once these mice experience GERD, they are fed hydrogel and then have their organs harvested in order to determine if the hydrogel was effective in controlling the GERD. Another researcher within GERD treatment has been Job Akimbe, an independent researcher and UNC hospital consultant who specializes in esophageal diseases. I caught up with him to ask him about the future of hydrogel and GERD treatment.
So the future of GERD treatment involves combination treatment, so combining surgery and medication, as well as change in lifestyle for the patients. There's also big work being done to prolong the length of medication, especially medication that affects esophageal mucosa. And so hopefully these treatments and new research that's being done in this area for new medications will improve patient prognosis. The idea of hydrogel is to prolong the effect of topical medications on the esophageal mucosa, and so this will make these medications more effective. So it is possible that the hydrogel in itself will improve application of topical medication in the esophageal mucosa.
Lastly, in order to gain a better perspective into the treatment side of GERD, I talked to Siki Ma, a nurse at UNC. Hi, Mrs. Ma.
Hi, Vincent. My name is Siki Ma. I'm a nurse at UNC who specializes in esophageal disease.
So what do you usually recommend when treating patients with GERD?
So for GERD, the two things I recommend to all the patients I see are lifestyle changes, such as avoiding alcohol and sugary foods, and also avoiding large meals. I also recommend medicines like Zantac, which is an over-the-counter anti-acid that helps significantly with the GERD symptoms.
So besides medication and lifestyle changes, what other treatment options exist for GERD?
I've seen it very little before, but there are surgical options, such as the insertion of a plastic ring around the gastroesophageal junction, which prevents acid reflux.
Okay, thank you very much, Mrs. Ma.
Thanks for having me, Vincent.
Throughout this study, I believe I've gained extensive knowledge on GERD, as well as built up much experience in the lab and hospital environment. I observed the movement of a new medical treatment from researcher to testing to treatment, and learned about the duties and goals of nurses, professors, and researchers. I also found new inspiration from working with people in all kinds of jobs with different goals and passions. Completing this project taught me more than just facts about a disease. It taught me about motivation and drive to pursue what compels and interests you in the name of science or the medical oath, working to discover or to heal rather than for pay. I can honestly say without a doubt that this independent project has been an amazing experience and very fulfilling. My name is Vincent Chen, and this has been GERD from Lab to Treatment. Thank you for watching.